Hi everyone, good evening. This is week 8 pre-conference for the 4th semester students for this week. We will be covering reproductive complications and also STDs. If there's anything I'm missing in your syllabi, it wasn't listed, so I'm just going based off that. So this is the most common STDs with treatments, pathophysiology. I'll also let you know which ones are reportable in New York State or not. And I'll also give you a link so you can see the form that you have to use to report them as well. Okay, first we have gonorrhea. This is caused by Neisseria, gonorrhea, inflammation of the mucous membranes. Source is going to be sexual contact. Neonatal conjunctivitis from delivery is also caused by gonorrhea. You can treat that with ophthalmic erythromycin. Treatment for this is IM ceftriaxone and azithromycin. You'll co-treat for chlamydia. I like to say G and C go better together. So G and C, we typically will treat both over just treating one, especially because a lot of times patients can be asymptomatic with chlamydia. It is pretty common. Gonorrhea, they usually will actually have somewhat of a symptom, but chlamydia, people can go years without knowing that they have it. So some considerations: the patient should be abstaining from sexual intercourse 7 days post-treatment. You do want to treat partners, and you should also test this patient for HIV. This is a reportable in New York State. And remember, for your NCLEX, purulent discharge is gonorrhea. Okay, next we have chlamydia. This is caused by chlamydia trachomitis. It is an intercellular infection of the GU tract. Source is sexual contact or vertical transmission. Treatment is doxycycline 100 milligrams BID, so 2 times a day for 7 days, or azithromycin 1 gram in a single dose. Some considerations is the patient should be retested within 3 months if they are diagnosed with chlamydia. You should also screen all sexually active patients that are less than 25 years of age. This is also a reportable in New York State. This is the number 1 cause of PID and infertility in women, so please keep that in mind. Next up, we have Trichomonas vaginalis. The source of sexual transmission pathophysiology is protozoal flagellate, which causes vaginitis. The treatment is metronidazole, also known as Flagyl, 500 milligrams BID for 7 days. You also want to treat the partner with this. They should avoid alcohol with metronidazole. It also causes green, yellow, frothy discharge. Remember the strawberry cervix or strawberry spots. That is going to equal trick. This is not a reportable in New York State, and under a microscope you'll see protozoas as well. Bacterial vaginosis. This is caused by Gardnerella vaginalis. This is an imbalance of normal flora of the vaginal canal. This is an overgrowth. This is not considered an STI. Treatment is metronidazole or clindamycin cream. Some considerations: the patient should avoid douching. The patient will complain of like a fishy odor with a gray discharge, typically after intercourse. This is also not a reportable in New York State. Your NCLEX tip for this is going to be clue cells on your slides that you'll see under the microscope. Okay, so we'll talk about yeast infections, Candida albicans, pathophysiology. This is an opportunistic fungal overgrowth. So the source is normal flora imbalance, so from antibiotics, patients that are diabetic or pregnant. Treatment for this is fluconazole, also known as diflucan, PO, typically 150 milligrams in 1 tablet, or you can do any topical antifungal. Considerations for this is going to be to avoid tight clothing, avoid douching. The pH is less than 4.5. This is not reportable in New York State. Under the microscope slide, you're going to see Candida budding yeast on a micrograph. And for the NCLEX tip, you should know all of the discharges for all of these, what it looks like, if there's an odor, if there's not an odor, the pH. So for yeast, you'll have a thick white curd-like discharge, almost like cottage cheese discharge, and that's going to equal yeast. And they also will complain of itching or burning with urination. That's also really common too with yeast infections. Okay, HSV1 and 2. HSV1 is considered cold sores. HSV2 is genital herpes. Pathophysiology is going to be herpes simplex virus, latent in nerve ganglia. And then when the patient is under stress, whether that's surgery, it could be pregnancy, it could be when they're sick, or they have an outbreak. That's what you'll want to consider. A lot of education needs to go with that regarding suppressive therapy to treat reoccurrences and prevent reoccurrences. So treatment is acyclovir or valcyclovir. The source is direct contact with the lesion or viral shedding. This is viral, so no antibiotics will work for this. So the patient should avoid contact during outbreak. You'll want to educate them on latency. This is not a reportable in New York State. And then if you have painful vesicles, you want to think of herpes. Mycoplasma genitalium, the patho is a small free living bacteria, can cause urethritis or cervicitis in patients. The source is from sexual contact. Treatment for this is going to be doxycycline followed by moxifloxacin if it does become resistant. You do want to consider that patients are typically co-infected with chlamydia or gonorrhea, so again, they may be getting a dose of doxycycline or a dose of ceftriaxone or both. This is not considered a reportable in New York State. And then if you have persistent symptoms after standard STI therapy, you need to think of mycoplasma. Hep B, the pathophysiology is hepatitis, hepatic inflammation. The source is from blood, sexual fluids, or perinatal. Treatment is supportive. You can do antivirals for chronic, so tenofovir or entecavir is another one that they use. Some considerations is there is a vaccine available. You do want to screen all pregnant women as well. And this is a reportable in New York State. So make sure you guys know the target organ for hepatitis obviously is going to be the liver. So the vaccine prevents HBV and there's none for HCV. Okay, hepatitis C, pathophysiology is flavivirus, chronic liver infection. The source is going to be bloodborne, so patients who have IV drug use or any patients that were receiving transfusions pre-1992. The treatment is going to be direct acting antiviral, so sulfaspivir, which is like a based regimen that patients typically are on. Some considerations, there isn't a vaccine, like I said on the last slide. Patients should also avoid alcohol because obviously the target organ here is going to be your liver. This is also a reportable in New York State. So HCV, silent but chronic. Okay, syphilis is caused by, I can never say this, Treponema pallidum. It's a spirochetes. Stages, you have primary, which is a chancre. Secondary is going to affect rash, palms, and soles with rashes. And then tertiary, you're going to have cardiac and central nervous system changes. Treatment for this is penicillin GIM, benzathine, and then you can give doxycycline if they have an allergy. Some considerations is a Jarek Herxheimer reaction. Please look that up. And then also you need to notify their partner because they need to get treated as well. Patients will complain of a painless ulcer with syphilis. So that's the biggest thing. There's no pain with the ulcer, but then you do have pain with herpes. So that's how you can kind of keep those apart. This is a reportable in New York State as well. Okay, HIV, retrovirus, which destroys your CD4 T cells. So remember, your CD4 cells, once they're gone, that's it. So the key is to really get your patients on ART therapy, antiretroviral therapy, to suppress the virus and to, keep a hold of the CD4 cells that the patient has. So, retrovirus is destroying the CD4 cells, which don't regenerate. Once they're gone, that's it. Plus the T cells, which causes immunodeficiency. So source is blood, sexual contact, vertical transmission. Antiretroviral viral therapy, heart therapy, art therapy you can treat with. Some considerations is you're going to always monitor the patient's viral load, the CD4 cell count. You should make yourself very, very familiar with that. And they need to have strict adherence with their medications. This is a reportable in New York State, and CD4 cell count less than 200 means the patient has AIDS.